So I'm an epidemiologist by background, and the reason, and that's the reason I work across data for both Camden and also Islington. And in Islington, I'm actually leading a project called Using Data Better, which does exactly what it says on the tin, really. Oops, already. So there's a widespread understanding across Islington that we want to use data better, both within the council and also with our partners. And we have a strong history of partnership working and using data collectively together. It's quite a devolved council in the way it works, so there are pockets of really good or piece of excellent work around data. We have a very strong children's function. They have linked up all their data to inform all the troubled families work. We call it Stronger Families locally, and they're using that to drive improvements and change. But we do also recognise there are quite a few gaps and missed opportunities about where we could be doing things better, and with partners, particularly with the agendas around more integration locally. We've had several previous attempts to get this off the ground and get things really moving forward, and they haven't worked for a variety of reasons. And I think one of the things was what Mike was saying about there wasn't one person who was just driving it. We kind of came together collectively previously in a room and we talked about it, but now and that didn't work. But now I've been tasked with sorting this out, so I'm the one really pushing this. So it's important that the programme is looking at the whole picture around data. It's not just about data quality, it's not just about doing bits of analysis. We're looking at whether we're asking the right questions from the beginning to answer with data, whether we're collecting high quality data, whether we should be stopping the collection of some bits. We have a habit of just expanding how much we're collecting, how we're managing it, so stuff around big data, whether we could be doing that more efficiently, and then what analysis we're doing. Do we need 100-page of reports, or do we just want one side which gives you the answer? We're also looking at how we disseminate the information we have. A lot of the problems around data seem to be that one person knows the answer and that isn't spread across the council or with our partners, so how could we do that better? And then most importantly, how we then take action to improve residents' lives. I mean, we're not just doing analysis for the fun of it, though I enjoy it, but yeah, it is ultimately we want to see action, and we will pick the projects where we think we can take some action to improve people's lives. So to make it happen, we have a steering group and a working group, and the important thing here is we have cross-organisational representation from quite a senior level. So we have 2 corporate directors on it, an assistant chief exec, and then several service directors and heads. We also are engaged with digital services, and they sit on there because, I mean, the technology is important, but we are very clear we're leading this from the business, and it is the business who's driving our requirements. There's obviously lots of information and governance and data sharing issues, so they play a crucial role on there. And we've most recently, we're getting our Islington CCG, so the local NHS, to start joining us, and over time we want to expand the range of partners around the table as well. On the working group, I mean, I lead that, and we've got all our analysts from a number of different backgrounds. And I think creating that professional network in the council is actually really important, and trying to drive those analysts to work together more as well. So to start off the project, we actually, rather than getting everyone in the room, because that didn't work last time, I did a whole load of one-to-one interviews with senior managers from across the council. It did take ages, to ask them what they wanted from their data. And actually, when you get them people one-to-one, I had to end some of the conversations after an hour, because they had so many requirements from data, and they were telling you where they couldn't do stuff, where there were barriers around information governance, where they just didn't know where to go. So but several themes dropped out. There's one around residents, which I'll talk about in more detail in a moment. There's a whole thing about doing place-based analysis and better use of GIS and mapping to inform decisions. And then there was something that came up around businesses and using data on businesses more, particularly around the change to business rates retention, and also looking at how we can use our data to find out where we can get more people locally employed using some of our business, and how high streets are changing, etc. We're just looking at the resident level data. There was a really big thing about sharing data on individuals for direct services. So, for example, our public protection team want to know who's coming out of hospital after a very long stay, so they can go and check that their boiler is still working, so you don't get sent back in the next week with hypothermia. There's something about this kind of big data for strategic planning and system redesign. So we already link some of our data sets, but we're not necessarily doing that very strategically across the council. And what should we be doing, and how should we be planning for the new data protection regulations in this area? There's something really about understanding population change. I think for us, obviously got the impacts of welfare reforms. We have questions about whether people in the borough who are in crisis have just turned up into the borough, whether they've been there a long time, and whether we could be doing better around early intervention and prevention. And then there's something about resident engagement, and I think that bit's really important because a lot of this stuff is quite quantitative, but there's also the qualitative aspect that we don't want to miss, and it's really for us a very mixed method approach, and it may be the quantitative data isn't good enough to tell us the answer, and we do need to be using that more contextual qualitative information. We have lots of issues around equalities monitoring. Are we doing it well enough? Are we collecting the right data on equalities? What could we be doing better? And then there seem to be quite a lot of opportunities in identifying fraud and linking up potentially, if we're able to, some of the big data sets to look at whether there is fraudulent activity around. So the big win for me, I think, is looking at the big data bits, because it's where we can add the most value. As I said, children's services are already quite advanced in this. In public health, we already hold all our GP and hospital admissions. We're about to link it to social care. So there are bits where we've done really well. But what we want to get to is a place where we think about this strategically in the council. We're currently mapping all of the data sets we hold to understand exactly what we have. And not from a digital services perspective, from a perspective of what is that data and how could it be used. And we're going to look across the life course of what data we hold on people, and look at and use that to inform our future plans. I mean, the new data protection regulations are high up on our agenda because of the impact they may have on how we can use data. So for people who don't know, in a couple of years we will have to get consent for the use of data. So we're very much using this exercise to look at what our requirements are now, and to have those much larger consent forms and privacy impact assessments, etc., ready at that time. In terms of doing more insightful and appropriate analysis, bringing the analysts together, this is just an example. We've been looking at violence against women and girls, and this diagram shows where epidemiology has hit crime analysis, and rather than just presenting the numbers of people or numbers of crimes and things, we've actually worked with those analysts to start estimating the scale of the problem in Islington, using some of the research evidence around. And really, to get some quick analysis done on key areas, we're running within the programme some task and finish groups. One was on domestic violence, and another one on youth crime as well. I think a real key thing for me is how we upskill our workforce in terms of analysts. I mean, people are often talking about using more data, but there's less talk, I think, around about how we do work with the analysts we have to develop them, particularly into more senior analysts and senior leaders, so we do get this kind of data revolution. And we're doing a number of things to do that. I guess I've split it into the analysts, who I think need to have need particular technical skills, and within that there's a mix of skills, they're not all one thing, and that people who can go in and interpret the right question that managers want answering, and then be able to communicate the results effectively. There's those who we want to be using data in their work all the time. I mean, I think we will be in a position where we have realised our vision once that every paper or every discussion we have in Islington starts off with what the data shows us, where that's appropriate. And it's very much an evidence-based approach. But those people need to know what to ask for, so they need to be intelligent commissioners of data, and they need to understand what good analysis is and be able to send it back if they don't think it's good enough. And then everyone else, it's about how they're accessing information if they do need it, and where they can go and ask for help. So in terms of the analysts specifically, we've been looking at a skills audit to understand what type of analysts we have in the organisation. And my hope, and we were just discussing it before this, was to start getting the analysts to be helping each other and mentoring each other in different technical areas. And we also want to start running training sessions for them and other people who need to use data. It is a really fast-paced area, so we also do want to start running lunchtime sessions and inviting speakers in so we can keep up with the changes, if we can. And then in terms of senior managers, I think it is a bit of training and around what good is and what they should be expecting in terms of data and analysis. In terms of dissemination, we have this thing called the Evidence Hub. We were really keen when we set this up. It's not just about raw data, it is about synthesising the evidence. So you can go and look there and it will tell you the story about violence against women or girls, or the story around obesity, and you can get all of that synthesised data. And we kind of quality assure that as well. So that's being relaunched over the summer. We hope with it's a more sophisticated site, because we have some users where we can't actually publish the data openly. So the stuff I send out to GPs, we can't put it out in the public domain. So we'll have a secure site underneath where we can share that. So in terms of enablers, I mean, most people put information governance as their challenge, but I think we should be seeing it as enabler, particularly the stuff around the new data protection regulations, because it will actually make people start thinking about what they actually want to use data for up front. And it will also hopefully sort out some of those grayer areas, which at the moment a lot of it is around interpretation about whether you can use it or not. We obviously rely a lot on our analysts and on their skills and the amount of resource we have. Whether we have enough resource, I don't know. We have a lot of questions come out, and that's something we'll have to look at over the coming months. We also, in terms of external developments, I am really pleased that we're starting to talk about London level stuff, because for me, we're only a borough of under 250,000 residents, which isn't statistically very big. And some of the analysis we want to do, we wouldn't actually be able to show anything on that scale. So I think there's a real need for doing something at a larger scale, whether that's in London or just with more boroughs around us. And then obviously there's quite a lot of change in terms of what we can do digitally. And for us, we have also, the digital services have just merged between Camden, Harringay and Islington. So we'll be looking at what we can learn from the other boroughs as well in terms of what they've done. So I said before, we haven't managed to do this in the past. So the way we're going to make this work this time is we're looking at the whole picture around data, not just one bit. We do have senior level support and buy-in for across the organisation, which I think is really important in getting people to do things and getting data shared and getting traction on stuff. It is being led by officers with backgrounds in data. Lots of those corporate directors, actually, one of them has an MA in statistics and things, so they're quite data savvy, so that really helps. And the drivers from the business, it isn't just from digital services, but obviously we'll work with digital services. We are thinking ahead, and we're going to about what we will need in the future, and we're going to build on our strong partnership working with other local public sector organisations, particularly the NHS, because that comes up quite a lot in terms of data sharing locally. And then we do recognise the need to value and develop our analysts as well, so we'll be working on that. So that's it.